Today I'm going to talk in continuation with our educational series on infertility with regards to the details in ART procedure. Actually, many patients, they want to know how we start and how many injections we give, what are the steps and what is the division, because we do nowadays in modern era in the year 26, of course, for the last 2-3 years we have adopted this technique of the segmented IVF. And what do we mean by segmented IVF? We are basically separating the procedure of the ICSI with the freezing from transferring the embryo, because that is enhancing the success rate. And the freeze all policy is not the common policy for all the successful ART specialists and IVF, including our success, because in India and in Telangana we started this because of the large number of the research which we did, and we concluded that this technique and this separation of the freezing from this separation and transfer of the embryos, FAT which we call it, it is giving more better success to our patients. So when we are doing in the first step, which is concluding, start from the COS, control ovarian stimulation, for almost 12 to 13 days, and oocyte aspiration, and doing intracytoplasmic sperm injection, injecting the husband sperm into the oocyte, and then process of the fertilization, 2-cell embryo, 4-cell embryo, 8-cell embryo, and it reaches the blastocyst, which it takes about 5 days culturing in the lab, and the last phase is the vitrification and freezing. This all will be completed during the process of the 5 to 6 days plus previous injection for 13 days. So it is 13 plus 6 days, 19 days. The first procedure, the first step will be completed. Now we do the freezing all, and then after 1 or 2 months, then we will do the FAT, frozen embryo thaw transfer, which gives very good success. We don't tell the patient that we know this is a success case. If we get 2 blastocysts, we definitely get success. The thing is, some of our overseas patients, they are from US or they are from abroad, or Australia or Saudi, they will have no time to stay. Husband can go, but the wife should stay till the second step, or they can go and come back and complete the procedure of the second step, which is a frozen embryo thaw transfer. And in about 6 days after transferring the embryo, if the HCG is approximately 70 to 80, below 100, it was a success case on the 6th day of the embryo transfer. And then we do alternate day HCG, and in HCG it reaches 1500 to 2000, we can do scanning and see the site, and after 1 or 2 weeks, then we see the fetal heart. And then after maybe they are about 8 to 10 weeks, they can travel abroad.